Good afternoon, everyone. Thank you for coming. Today we will be talking about vaccines. Just by a show of hands, has anyone here not had their vaccines as a child? Okay. And has anyone here ever had measles, mumps, smallpox, chickenpox?
Chickenpox.
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 Okay.
Chickenpox, measles, and mumps.
Oh, see, this is what happens when you don't have your vaccines.
Oh.
All right, let's get started. Okay, so in 2013, 90% of the children who died from the flu were not vaccinated. Imagine if those children had been vaccinated. Imagine a world where children can live without the fear of polio, measles, mumps, or tetanus. Imagine these diseases being practically extinct outside of a laboratory. Vaccines are the only hope for this dream to become a reality. Vaccines have the ability to eradicate these diseases, similar to how smallpox was eliminated in 1979. To begin, vaccines naturally build defense by fighting bacteria from the disease. Each bacteria carries a unique marker that is different from an individual cell's marker. This difference is how the body is able to recognize the danger. When the body realizes this foreign bacteria, it begins fighting against it, and the vaccine will mimic the natural infection by using a weakened sample of the virus. So the body will then react to the vaccine as it would to the real virus. The cells are then able to withhold this information and cause the future immunity. Another great aspect of vaccines is that the virus it is giving to the patients is not contagious. So vaccines run zero risk of spreading the infection. In 1989, an outbreak of measles in the U.S. was caused because parents did not have the finances to vaccinate their children. Since then, the Vaccines for Children was created, a federally funded program that provides vaccines to children with families who are unable to afford it. Because of how contagious these viruses are, one child not vaccinated could cause an outbreak that would harm many. Some people are unable to be vaccinated because of health and age restrictions, and because of this, they are even more vulnerable to unvaccinated children. If a healthy child exposes one of these unhealthy people to the virus, an even bigger outbreak can occur. But health is not the only perk of vaccinating. Since the Vaccines for Children was created, $295 billion was saved in direct costs, and $1.38 trillion was saved in societal costs, because people weren't going to the hospital as much, and they didn't have to go to as many doctor's appointments that cost lots of money. Vaccinating puts off the larger costs of hospital bills and sometimes premature death. Not vaccinating a child can also hinder their access to education and medical treatment. In Prince versus Massachusetts, it was stated that an unvaccinated child can be prohibited from going to school. A physician could also deny treatment to an unvaccinated child. Being unvaccinated can strongly inhibit a child's growth in the classroom and their growth as a healthy person. Overall, vaccines are imperative to the health and safety of our society. Unvaccinated children can lead to unavoidable problems such as deadly infections of preventable diseases, medical costs, loss of education, and medical care. If children remain unvaccinated into adulthood, themselves and our society will suffer. Thank you.
4 minutes.
Just 4?